All right, well, it looks like we are going to get started. And welcome everyone to this exciting webinar. I'm Kristin Kidd and I'm from the Southeast Prevention Technology Transfer Center. And I'm here with my esteemed colleague, Nicole Augustine from SPTAC. And we'll tell you a little bit more about our agencies in just a minute. But I'd like to thank Ashley, who I believe is not on. I believe she's traveling today, but Ashley from the Addiction Prevention Coalition. We're just really grateful that she invited us to come and share some information to you about and introduce the strategic prevention framework. So a little bit of housekeeping. I do need to say that this training is 100% supported by SAMHSA, the Substance Abuse and Mental Health Services Administration. And what we're going to be sharing today are the views of Nicole and I, and they don't necessarily represent, nor are they endorsed by SAMHSA, HHS, or the US government. So this is the PTTC network. We are at Wake Forest University School of Medicine. We serve 8 states here in the Southeast, from Kentucky all the way down to Florida and over to Mississippi. There are 10 regional centers across the United States. So I see we've got Maryland in the house, we got Minnesota in the house. If you don't know, you do have a PTTC that serves you. And really the Prevention Technology Transfer Centers are here for the prevention workforce to provide free training and technical assistance where really your tax dollars at work.
And I'll say, we are also your tax dollars at work. So if you haven't heard of SAMHSA's newest TA center, the Strategic Prevention Technical Assistance Center, my name is Nicole Augustine. I'm the Regional Director for Regions 3 and 4. We provide support for a very specific set of grantees that are focused on really using the SPIF model. So we love to collaborate with the PTTC and super excited to be doing this webinar together today.
So who are your trainers? So as I said, my name is Kristin Kidd and I'm with the Southeast Prevention Technology Transfer Center. I'm the co-coordinator. I work with Amber. If any of you have talked to Amber Jones, I've been in prevention now for, I don't know, it feels like a really long time. I started in tobacco control. And my focus really is on local policy change. So as we talk about the strategic prevention framework today, there's a lot of focus generally in the field of prevention on individual strategies and working with one-on-one or working with curriculum in schools. I really am going to try and bring the lens of more environmental strategies as we share examples and talk about systems change and policy change. Just very little, because this is just an overview. We only have 90 minutes to talk about the strategic prevention framework. So we're just going to be introducing the concepts at a really high level. And Nicole?
Awesome. So my name is Nicole Augustine. Obviously, this is a dated picture because my hair has grown. But it truly is a pleasure to be here today with you all. My background is in public health, sociology. I've been doing prevention work for a long time. I got into prevention actually in college. And that's where I really learned and understand concepts around underage drinking prevention strategies, really kind of birthed my love for the prevention space. So I'm really excited to be here. I do a lot of work in strategic planning, working with coalitions. And as SPTAC, like I said, we really come alongside organizations and coalitions like yourself to really help folks think about how do I actually use SPIF to get this work done. So super excited to be here today with you all and to be talking. I would say just in general, we encourage you all. Chris and I are very interactive as presenters. So feel free to use the chat if we say something you like, you know, and be interactive with us along the way. All right, so we're going to kick this off. I am curious. Let's see if folks know how to use the reactions in Zoom. If you have seen the SPIF graphic before, use the thumbs up mark from Zoom here. I'd like to see if folks know how to do that, know what reactions are. Let's see how many thumbs up we got in the room here of folks who have seen this before. Thank you. You can even put it in the chat. Appreciate it.
Seeing just a few, not very many. I'm seeing a thumbs down. Great, that's helpful too.
That's helpful too.
Yeah.
Awesome. Okay. So for those of you who have seen this before, it probably looks a little bit different. We've got equity circling around it, which is new. This is actually the new graphic that is under review right now, which I'm super excited about. We've been having a lot of conversations with SAMHSA around how to embed equity into the work we do. So that is going to be at the forefront of this entire conversation today. But just wanted to explain for those of you who have seen it before, why you're seeing this new equity around. For those of you, this is your first time, I'm so happy that this is the graphic that you're beginning to know and learn about. Focused on that. So we are going to be walking through this to really look at an overview of what it means to use SAMHSA Strategic Prevention Framework to push forward your work in the communities that you're working with. So we'll go ahead and get started here with assessment. And what do we mean by assessing? And I'll say this as we go through this. We're going to walk through this step by step. But the reality is when you're doing this work in the field, you may not always start exactly at assessment and then move to something and never come back. These spaces are very fluid. So I do want to kind of just give that as a disclaimer here. But we start with the data because it's really important to know exactly what is the problem in a community. How long has it been going on? What are the biggest issues? What do I really need to know? And in our assessment, this is what really helps us get a clear picture of what's happening in the communities that we serve. You know, with our work, whether you are focused on underage drinking prevention, underage substance use in general, we've got to really understand what the actual problems are, what they're related to, the kind of in-depth why of why something's happening and occurring in a particular community. And most importantly, is we really look at the connection of the risk and protective factors. We're going to talk about these a little bit more, but that's really our place of change. And sometimes I think in prevention, or just in general, people get a little bit confused about what prevention is. We're actually not working to change behavior. Because when you think about it, behavior change is a challenge, okay? We're actually looking to create movements on the risk and protective factors in a community and around an individual. And that's a really specific distinction for what we do in our prevention work. So when we're doing our strategies, that's really the focus and intention, is we first have to understand what are the risk factors related to substance use, right? So that we then can develop strategies that reduce the risk and improve the protection, okay? And it all starts with how we gather our data here. And our comprehensive needs assessment really lets us make those right choices around how we develop our strategies over time. A concept I want to share here when we're doing assessments is the concept around ACEs, adverse childhood experiences. Because one of the things, despite the fact that ACEs has been in knowledge since the 90s, I know for me in my earlier years of prevention, we weren't really talking about ACEs, and we definitely weren't looking for when we were doing our needs assessment. And so we're really thinking about how do we think about and embed ACEs into our work. And so I want to show just a short video that actually comes from CDC on ACEs. If it's something you haven't heard of, I think this video gives a really cool, quick example of what to think about. Let me just check here and make sure that my computer sound is being shared. Wonderful. Okay, I think we're all good.
Hi, this is my neighborhood. I grew up in this building. This is a great community now, but it's had its share of problems. When I was a kid, our community had high unemployment, a lack of resources for families, and lots of kids hanging out with no adult supervision. You might have heard about adverse childhood experiences, or ACEs. ACEs are traumatic events in childhood, like abuse and neglect, that can increase risk for future problems. But they don't have to. The good news is that ACEs and their consequences can be prevented. Take me, for example. I was at risk for ACEs, and despite all the things that put me at risk, some pretty incredible people helped make sure that I wouldn't become another statistic. Come on, I'll show you around. That's Jackson. He's a cool kid. His dad left when he was 2, and his mom works 2 jobs. I hang out with him every Thursday night and help him with his homework. Sometimes we grab ice cream. It's fun. Plus, he has another adult role model to learn from and trust. That's Mr. Martino. When I was a kid, he let me help him at the store sometimes after school when my parents were working late. He did that for a bunch of us. My dad actually found his job as a mechanic because of Mr. Martino. This helped our family in so many ways. Not only did my dad have a steady paycheck, which eased his stress about paying rent and buying necessities like food and clothes, but he was also a lot nicer to me, my brother, and my mom once he started working a job that made him feel good about himself. When communities come together, they can do so much to prevent ACEs. Mr. Martino and other local business owners put together a series of career workshops to help people like my dad find work. My mom also got a job with a company that allowed her to work from home and spend more time with me and my brother. Mariana has just gotten out of a class about handling challenges of single parenting. The clinic offers free childcare so Mariana's daughter, Ella, can play while Mariana's in class. The class helps parents like Mariana develop positive parenting skills, not just for babies and toddlers, but for teenagers too. This is another way our community has come together to give families the resources they need, and just one more way to prevent ACEs. This was my school, Riverside Middle, right in the heart of town. These kids are here for a sponsored summer camp. This community-supported program helps families with affordable, quality childcare and helps kids get tutoring and learn life skills. When I was a kid, I spent a lot of time at this school all year long. There was one counselor, Miss Greer, who I remember more than anyone. She was a really good listener. Miss Greer helped me and my brother get involved in after-school activities like baseball and soccer. Our coaches were super nice and were mentors to us. Staying after school for practice kept us and a lot of other kids out of trouble. When schools help take responsibility for preventing ACEs, everybody wins. My life could have gone in a completely different direction. Studies show that ACEs can have long-term negative effects on kids' health and well-being that may last into adulthood and even continue in future generations. But by people and groups taking action, ACEs can be prevented. In fact, there are 5 known strategies that help stop ACEs before they even start. You can implement them in your own community, just like we did. How? By strengthening economic support for families. By changing social norms to support parents in positive parenting. By providing quality care and education early in life. By enhancing parenting skills to promote healthy child development. And by intervening to lessen harms and prevent future risk. So, now you know my story, and you've seen the prevention strategies in my community that helped me beat the odds. I had healthy relationships with my family and friends. I learned how to take care of myself and make good choices. And today, I'm a mentor to other kids who need some extra help so they don't become an ACEs statistic. Safe, stable, and nurturing relationships and environments are essential to prevent child abuse and neglect and to assure that all kids reach their full potential. Are you thinking what I'm thinking? Banana split? You got it.
Wow, such a lovely video. So I'm going to give you all an opportunity to interact with this here. And there's a couple ways you can do this. You could grab your phone, open up the camera on your phone, just show that QR code, and it's going to bring it up on your phone here called Mentimeter. Now, if you prefer to use your laptop in front of you, that's fine. You can open up a browser, just type in menti.com as you're seeing there on the screen. It's going to ask you for a code. Simply type that code in there and you will be all set. You only need to do this one time, but this is how we'll also do some anonymous interactions. I saw in the chat, I asked about the slides. We typically wait till afterwards because we'll download the Mentimeter version of the slide deck because that will actually have all the interactive pieces in the presentation for you all to review later. So I'm beginning to see people give the thumbs up that they got into Mentimeter. I appreciate that. Let's see how many folks are inside of Mentimeter here. I want to give our first question. Because I'm curious how many of you are exploring the connection between ACEs and health outcomes in your community needs assessment. We want to get a sense of how many folks are doing this, because this is somewhat new, not that the concept is new, but it's actually collecting data on ACEs and looking at that connection around the health outcomes. Because they're very strong predictors around ACEs and substance use. And in fact, what we also find is that often for folks who are in the helping field, we on average have higher ACEs just because of the nature of this particular work. And often it is because of the ACEs that people end up in helping professions, interestingly. So this is wonderful. I'm really seeing, thank you all for the number of folks who are saying, you know what, we are looking at this connection because I think it's a very strong connection to look at. The reality is we are in the field of substance misuse prevention. And when you really are looking at the risk and protective factors, those are connected to many other things, not just SUD, suicide prevention, teen pregnancy. There's a lot, violence, there's a lot of other components that when we focus on risk and protective factors, we have the opportunity to make some pretty significant changes. So thank you all for that. I've mentioned risk and protective factors many times, so let's define them here. I love this graphic, you all, of this umbrella. Imagine our protective factors are our umbrella, right? What are the things that are helping me thrive and survive despite my environmental circumstances? And those are the risk factors. So what are the things that are happening that increase the likelihood, whether that's personal to me, okay, things like genetics, right? But it could be more environmental. A risk factor could be my community, the fact that every few blocks, there's a place to buy tobacco, there's a place to buy alcohol, or I'm a young person who is seeing a lot of alcohol ads, right? That's some of the community stuff. You can even look at risk factors in the family environment. Risk factors around whether or not your parent is someone who uses a substance. Incarceration, there's a whole list of things. And if you are unfamiliar with this, I encourage you after this presentation to do a little bit of Googling and research yourself on risk and protective factors. There are a lot of resources out there that will really help you look at what the risk factors are for substance use disorder specifically, and what the protective factors are, right? Because we're in the business of creating more umbrellas for the communities we serve, right? Sometimes we can't do anything about the rain, the clouds, those sorts of things, but we can create umbrellas. And that's why I really love this graphic here for understanding our work. When you're doing your needs assessment, it is really critical that you gather data to understand what the community landscape looks like. It's a really important component of the work. And I'll say, connected to this is one of the reasons why I always love talking with Kristin, because she has a very specific lens on environmental pieces. And when I think about the risk factors that are connected to environment, this is where policy change becomes an amazing tool to really shift what's happening in a particular community. So just want to kind of encourage you all around that.
Absolutely, because when it talked about the 5 strategies recommended to tackle ACEs, 2 of them were environmental, talking about economic policies to help people have a living wage and be able to buy the things they need, and then changing social norms. That's what policy is all about. I mean, how many of you walk into a restaurant and are asked smoking and non-smoking anymore? In most states, you're not. And my children have never been asked that question. So it's changing the culture.
Oh, I love that example, Kristin. Thank you for that. Like truly, truly. And you all, we get the greatest bang for our buck when we move for environmental approaches to doing our prevention work. So just a couple of things here in assessment. As you can tell, I'm a little bit passionate about this here. Because I really do feel like when we do our assessment right, it really impacts the rest of the SPIF process. Because once you really have a clear picture, you choose your strategies very, very differently. You really do. And I think that's where our power comes. A critical thing to remember during assessment, you all, is making sure you also have an understanding of what resources exist in the community already. You know, sometimes we come into this work with what I think of as a savior complex, as if a community is damaged, they need our help from the outside. But the reality is communities are filled with resources often that just need to be amplified and supported. And your resources that the community already has can be your greatest partner and your greatest champion for making sure the work moves forward. So when you're doing your needs assessment, please be sure to take some time to look for resources, or sometimes you'll hear it called assets in a community. And in addition to that, you also want to look at readiness. So when we talk about readiness, what this means is, to what degree is the community really ready, interested, motivated to address a particular challenge? And sometimes what will happen is, before you can even begin a project, you have to work on improving the readiness. Because if you skip improving readiness, you will move into planning, have these wonderful, brilliant ideas, and the community won't be supportive or won't really show up for those things. So you want to really be looking at, how ready is the community to address, let's say you're taking on underage drinking. If it's a community where you've found out that there's a cultural norm around drinking with young people, you're going to have a really hard time doing some programming that is against that, right? So you'll need to work on the readiness first for the community to be open to a plan. It's an important thing to think about here when you're doing this work.
Right. I mean, you often hear that nothing about us without us. If you go and try to do something without them, I mean, it's not our job to necessarily do the work. It's our job to empower and engage partners and residents to help us and move the work forward. And if they're not with you, it's just not going to happen.
I totally agree. I've seen it happen time and time again. Not skipping this part and getting to implementation and the project getting blocked because someone's like, "Ooh, we can't do that here."
Right.
You know, but you've spent months planning, and the community is like, "That's not going to work." So it's an important thing not to skip, for sure. So we said in this training, we're also going to be bringing an equity lens with each of these steps. So for each, just so you know how we'll be moving forward, we'll talk about the step a little bit, describe some things, and then we'll also always end with this concept of, what's a health equity lens or question you should be asking yourself in this step? So when we're in the assessment phases, there are really two central questions that we like to think about. Is, when you're looking at your data, do you notice that there are any differences in how one community is experiencing consequences versus another? Or how one community might have consumption patterns different than another? You really kind of want to look out for those sorts of things so that you can begin to see, are there any disparities happening in my community, right? Because disparities are preventable differences in health outcomes. And we're in the business of prevention. So if anything, we look for those differences so that we can see and understand why they exist and begin to distribute our resources in a way that helps reduce those differences. So these are the two questions we kind of wanted to leave you all with. All right. So I spent most of the time, a lot of time here in assessment, but your assessment is the base, really. You can't do much else without knowing what's really happening in your community. All right, so moving along to capacity, all right? At this point in our process, we have a really good sense of what are the risks and protective factors that are happening. But now we have to determine, just because we know what's wrong, does it mean we're ready to deal with it or that we're able to? So I like to give analogies as the way that my brain works. So if I'm thinking about chocolate cake and I've decided that chocolate cake is what I need, it's a part of my assessment personally. If I don't have, I need to still understand my capacity. Do I have flour? Do I have oil? Do I have the chocolate powder to make it? Do I even have a mixer, right? The capacity phase is all about recognizing, understanding, yes, I know the need, but do we truly have the human resources, the financial resources, the intellectual resources, right? The political will in a community, right? This connects back to readiness too. do we actually have the capacity to get the work done? Because even if you show that there's a need, you may not have the capacity, and you've got to spend some time building that first in order to really move successfully through the SPIF process. So what are some of the things we think about when we're looking at capacity? We're wanting to look at how we improve our resources. Now, if you remember, in assessment, we said we're going to look at what are the resources that already exist in the community, right? So we're walking into this not necessarily with a deficit mindset, but saying, here's what we've discovered about the resources in a community. How can we amplify that? How can we tap into those resources to really move our work forward and have even greater reach? And this becomes all about relationship building, you all about strengthening partnerships with various organizations that will help you get the work done. Something I hear a lot is that in prevention, our financial resources are limited. So often your partnerships help you get some things done that you couldn't get done by yourself, you know? And so that becomes an important thing to think about and consider. The other couple things you're looking at here is capacity also is around how do we prepare our workforce? How do we prepare us to have the knowledge to do the work and our community partners to do the work too? Oh, thank you, Leo. I was just looking at the chat. I love this definition of capacity. Yes. Pause, consider the possibilities of maybe, right? So this really kind of helps us think about how we are able to do the work moving forward. You know, with the SAMHSA Strategic Prevention Framework, these are some of the strategies that we think about when we're looking at capacity. We're going to talk about each of these just a bit. And there's three main buckets here: engaging our stakeholders, which as I see the word stakeholders, I do feel like we're shifting the language, and I see Kristin nodding here. So yeah. I'll just share a sidebar here with you all. I always like to say this: I am always learning. I'm learning with you all. And our work in our field is ever evolving. And one of the critical places where we are evolving majorly is the language we use. Making sure our language is inclusive. So there has been question about the word stakeholder as language. And so really, I would probably edit this slide and say that, you know, engaging diverse community members, community partners, right, versus a stakeholder. But maybe we can share a resource around language, because I think the PTTC actually did a language guide for how we're expanding our language in prevention. So we'll share that out. But as I see the word stakeholder, it kind of reminded me of that. We also want to think about how we're strengthening our team to do this work and how we're raising awareness on the particular issue. So a couple things to kind of just note here in working with community partners is the behavioral health problems in a community experiences are complex. And so we do need a diverse group of community members who touch various components of this work. If you think back to the video that we watched earlier, I was seeing all the different partners, right? The school, the businesses, you know, community-based organizations, faith-based communities. There's so many partners who end up interacting with young people's lives who could really be strategic in the work that we do. And so you want to really kind of do an assessment. If there are any of you who do DFC, for instance, they provide a really cool model of the 12 sectors, right? Of how you look at what are the types of organizations you want to be partnering with, as just an example of how you can be extremely diverse in who you bring to the table to get your work done. You also
I think,
yes,
I was going to say, going back to talking about some of the questions you ask in your assessment about consumption rates, what communities have higher consumption rates, and which communities have more or suffering more disparities. It's important to look at specific partners within those communities, because those often are partners who maybe have never been engaged in this work, that have a lot to share. They may have lived experience to share. So it's important to go to the specific communities and look for what's already going on and who's already wanting to do the work, or should be engaged in the work.
Yeah, thank you for mentioning that. Great point there. Connected to this is the building the relationship, right? Because sometimes what happens is there can be a spirit of competition in our grant world, in our grant spaces. And so, a part of this too is building the relationship so that the community knows and understands why your organization exists, because I think in the utopia, we almost want the community kind of coming to us to say, hey, we're thinking about writing for a grant, or we're wanting to address this problem. You in prevention help us do this thing, right? Because we're the consultant to the community. So as we build more relationships, I think we can experience being invited in early on grant applications, just like we want to invite communities into our grant applications.
Jean
So this
talked
could
about
be,
this. I'm sorry,
yeah.
Jean
Oh,
mentioned,
go
you were
ahead.
talking about territoriality. Jean actually put a comment in the chat about the territoriality of nonprofits and agencies, especially in rural communities where it might be a much smaller number, that everyone's kind of going for the same pot. So building relationships and breaking down barriers is really key.
Yeah, because I find you get more done together versus in competition.
Yeah.
And a really good collaboration becomes a business partnership too. So I think sometimes we forget these are all businesses too,
Yeah.
And so that can be extremely beneficial way to think about it.
Well, and I love what you said, Nicole, about we would ideally like the community to come to us and say, would you partner with us? So for me and other projects I work on, it's all about building the capacity of the community to assess and to decide on what they want to work on, plan, and then implement. So that this nonprofit industrial complex that we have, where we're constantly writing for grants, maybe we really step back and the community can start to walk on their own.
Oh
Yeah.
man, that is powerful. You used a big word.
Mm.
Nonprofit industrial complex. Okay. But yes, these are really important things to think about and consider of how do we get the money closer to the community for the work that needs to happen, and the partnerships and relationships are a really wonderful way to do that. So we're going to go back to Menti. Now, if you still have it on your phone or open as a browser, you shouldn't need to do anything more than it just pop up. But I did put the code back up here. I am curious from your perspective, to what degree do you feel your organization is trusted by the community you serve? Has a few minutes here. Okay. Great. Okay. Votes are coming in. Thank you all for voting. I appreciate that. Good stuff. So an overwhelming majority of you all are saying yes. While I appreciate the folks who are saying, we got some work to do. And
Yeah.
some folks saying, actually, I don't even know. Right? But it'd be an important thing to discover is, does the community trust you and trust your organization? Because trust is a critical piece to partnerships and to capacity. So wonderful. Thank you all for this. Just some things to kind of think about as you're considering the capacity and the work you're doing and the space for growth that could be there around those things. Wonderful.
That makes me wonder about, are we serving the same community over and over because we have a connection and there is trust there? And if so, what other communities are really experiencing challenges and issues and disparities that we haven't tapped yet? We haven't built that relationship and started to work on that trust.
Yeah.
Could be those are the communities we need to start that connection with.
Absolutely. Calling people in, right, to the work, calling folks in. Yeah, that's great. Okay, so moving along here, we have a good picture of what's happening in our community. We now feel, okay, we know our capacity, and maybe as a result of what you learned in the capacity and assessment, you're having a pause before you can go to planning. Because sometimes these two steps help you discover, okay, we've got to improve our readiness first before we can plan anything. And we need to improve our capacity before we can plan anything. So again, I don't want you all to think that you just kind of run through these steps. You really don't. I have seen some folks get to through assessment and capacity and really have a lot of work to do before they can even enter the planning stage. Because remember, the work that you're doing is for the community, not for you. Okay? Which means the community really should be actively involved in this process. So my question becomes, how can you really move into planning a project, an initiative, if your community is not ready and if you don't have capacity? So sometimes you got to do some other type of work so that you can get people at the table to truly plan for an intervention that the community will say, you know what, we helped discover this, we helped figure this out. It naturally will improve your sustainability.
Nicole, have you seen examples where an agency may say, you know what, we've got this curriculum, we've already paid for it, let's go do this in the middle schools without any assessment or capacity? Have you seen that?
Oh, all the time.
Hmm.
Actually, I see that a lot. It's one
Well,
of the most popular things to do, especially because we do have really wonderful curriculums out there. And so I do see where the kind of go-to is, oh, we've already invested in Project Alert or Too Good for Drugs or life skills, right? There's all these really great, wonderful curriculums out there. And you'll see people just pull it off the shelf and say, let's do this at this school. Which it's
mhm.
not saying that you couldn't do any good, like you're going to do
Right,
good, but that may not have been the best use of your resources,
right, right.
you know?
Mhm.
So thank you for that question. I appreciate sharing that too, actually, because it's one of the easier things to do, really, when you think about it.
Yeah. Well, and I've seen communities where they say, oh, X community decided to implement this policy, and that's a great policy. We need to implement it here. And they start working and churning and they're getting ready to implement. And then they find out it's already on the books. It's just not being enforced.
Yeah,
So they
right.
could have saved themselves a lot of time.
Right, because that's a whole different problem, enforcement,
Yeah,
and a completely different strategy
right.
altogether, right? So yeah, and so that's why sometimes you really got to take that pause after those first two steps before you move here.
Mhm.
Because you can sometimes put the cart before the horse, as
Yes.
my grandmother would say. All right, so planning, strategic planning, this is the part of the work that really helps increase our effectiveness. It's also sometimes a part of the work that some people find the most labor intensive. If you're doing coalition work, sometimes the planning phase is where you lose people because people sign up to implement. They're like, I want to do something. And there are some personalities that really struggle with the planning process. But ideally, this is such a critical moment to making sure that everything that I've learned before in my assessment at capacity, I'm applying it in a way that's really going to make the implementation successful, make the evaluation successful. And so this becomes a really critical component. And I always say when you're doing coalition work, if you can, sometimes it's helpful to do a little bit of like a personality test to find out who are the people in your group who love planning and allow them to really dig into this. Because what I have seen is sometimes some groups lose membership in the planning phases for the people who are your doers. So just other things that's important to think about as a coalition is how to really strategically use people throughout the entire process. So just a sidebar to think about there. But planning is a really critical component. So some of you may have heard of the acronym VMOSA. I say VMOSA, but I don't know if you're supposed to say it that way. That's what I say. Uh, so in your planning, you really want to take a time to think about these main pieces. What is the overall vision, right? So as a coalition, what is the vision that you hope to see in the community if you all are truly successful? I like to think of my vision statement as this. In 10 years, if we got it right, what does it look like? Paint that picture of the community, okay? And then your mission is much more tactical. This is really thinking about how do we help make that vision happen? What's our mission? What are we focused on? Okay. From there, you begin to, once you have your mission, you're being able to identify what are your specific objectives that you're trying to reach. Okay, what are your strategies that help you reach your objectives? All right, all these things build on each other. And then the kind of like nuts and bolts is your action plan. This is where you're really looking at, okay, who's going to do what, by when, with what resources, in what timeline, okay? This is when you get into that really detailed space. And all of this is the part you do during planning. And this is why I say sometimes you lose your action focused people, because they're like, well, I just want to know when I need to show up and what I need to do, you know? Yet, if you don't spend time really looking at this, you'll develop a plan that will be out of alignment, really, with what you discovered in your needs assessment or your capacity. So you really want to kind of think about this in your planning phases. With our planning, we want to consider a few things here to really ensure that we're developing a solid plan for addressing the community need. Like we've done in our assessment, we've discovered what the risks and protective factors are. In our planning phases, we're beginning to prioritize because, right, unfortunately, we don't have unlimited budgets. So we sometimes can't address everything. And as a result of that, you've got to kind of prioritize which risks and protective factors your funding will support, your capacity will support, okay? And then you want to match your prevention strategies with those said risks and protective factors. And this sometimes, you all, this is where I get to do a lot of my work with coalitions, is making sure there's a match there. Because sometimes this is where things get out of alignment and mismatched. And so one of the critical tools people can use in this space is a logic model to help them with this. And I'll provide an example here because I think sometimes people don't realize how the mismatching happens. And I'll give an example from a coalition I did some work with years ago now. They had done their assessment to discover that the challenge they wanted to work on was students saying that they had easy access to prescription medications. They were not locked in the home, and they could easily get them and take a few out and their parents not know. And they did this by doing community surveys. So one of the things they decided to focus on was helping parents understand the importance of monitoring their prescription medications and securing them. So they really wanted to focus on that. And I was like, that's wonderful. Well, we got to the planning of the strategies, and all of their strategies were focused on doing prevention education with the high school students. And so I asked, how does doing prevention education with high school students help the parents monitor and secure medications? And it was like a pause. It was like, huh. It doesn't. But think about how often we do that. We do that exact thing. And so that's an example of how sometimes we do all the work, but then we get to hear and we align it with a strategy that's not really going to create movement on the true risk or protective factor that we've identified. We're just picking the thing that we do well or do most. So this is why, for me, planning really becomes a part of truly looking at those things and aligning them together.
I see that in policy work as well, where maybe a community that is working or a coalition working on policy change might focus on enforcement alone and say, all right, well, our goal, we're going to be penalizing youth who are caught drinking, or we're going to strengthen the penalties against young people who are caught drinking or smoking or whatever it is. And there's not the movement to think about the retailers that might be illegally selling these products, or the focus on the zoning around, there are too many stores around the school. We need to be more comprehensive and move even more upstream with our focus.
Absolutely. Thank you for that. Yeah, this is good stuff, and I think sometimes in our just movement, we miss that one little small thing there, which can make a huge difference. Because then for me, right, our planning also becomes the framework for our evaluation. Okay, I know we haven't got to the evaluation step, but some of the thing I talk to people a lot is during your planning, you should be planning for your evaluation. So in the example I gave, right, their evaluation metrics were all around surveying the young people and whether or not, they still felt they had easy access, which is going to give you some information around it. But
Yeah.
really what we want to know is, have parents created behavior change around whether or not they're monitoring and securing? And I can learn it somewhat indirectly by, surveying the students, but wouldn't it be even more powerful to survey the parents directly too, as a part of that? And if I don't plan for it, I won't do it, is what happens. And what happens at the end is you're in evaluation trying to figure out, okay, how did this work? And you're realizing, oh, I wish we had asked this, but it's too late. You're already through implementation. So you do, during your planning, really have to think about your evaluation metrics also. This is why I say, it's shown as separate steps, but you're really thinking about
Right.
a lot of these things together, truly. So I want to just share this graphic here, because one of the things I did say that we typically don't have money to take on everything. And so an important task you'll be doing in planning is your prioritization. So I like this graphic because what this graphic helps us think about is, you want to spend your time, if you can, on something that has high importance and changeability, because that means you're going to really move something pretty far. If you go to the bottom left column, which is low importance and low changeability, I mean, first of all, you're going to have a hard time getting your community to even care about the issue. And it'd be like pushing a rock
Y'all, we don't need to
uphill.
push rocks.
We
The
don't need to
work's
do any of that.
it's challenging enough.
It's challenging enough. So when you all are looking at what's happening in your community, really think about rating what is the level of importance of this particular risk and protective factor for the community, and how changeable is this? Because you also want to have some wins in this work. It's no sense in choosing something that, like, it feels it would be way too impossible to change, right? So this graphic helps you kind of think about that. I've seen communities look at the risk and protective factors and actually drop them in this grid and say, okay, so we'll look at everything that's in the top right, and the other things we just won't address, sort of thing. So you really kind of make this a collaborative process.
Well, and this makes me think back to when you talked about assessment and capacity. You were talking about, alcohol, maybe binge drinking is a real problem in the community, or underage alcohol consumption, but the community has the social norming around, it's a rite of passage, or, we'll drink with our young people. It's just what's going to happen. So that's where maybe it's high importance, but
Yeah,
low
low
changeability, because
changeability.
you've got to factor in working on that social norm change. And if you don't,
Exactly.
it's not going to happen.
Exactly. Yeah. So this, and I appreciate that example too, because like really looking at it this way, you're not truly ready to just run and say go.
Yeah.
There's some things you may have to really work on first, because some people still choose high importance, low changeability.
Mm.
Some
Mm-hmm.
people choose that because they're like, it is important, we can work on the changeability. I'd be curious, what are going to be your strategies to do that?
Right.
And is
Right.
it worth it?
Well, exactly. And there are hot topics out there, and communities might be charging ahead on something, but one community is one community, and what works in one does not necessarily work in another. And this is where that data comes in, and it's so important to be data driven. Now, I will say sometimes, especially as I keep going to the policy world, sometimes you tackle the low hanging fruit first to get a win, so that then you have a strategic plan where you play out, we're going to go tackle bigger things once we've gotten that, the community really supports us and has trust with us. So maybe low importance, but high changeability is where you start, knowing that you're going to move up to the right corner of the box next.
Absolutely. I love that example. So true. So true. And, you know, the reality is, you all, the work is happening in collaboration with the community. So as long as you have support and your coalition's like, you know what, we're going to go for the box that is low importance, high changeability to get that win, take the win, right?
Yes.
It's a part of the building of the relationship, the momentum into the next thing. So let's bring us back to Minty here. I am curious for you all. Would you say that we've identified our risks and protective factors for our community? And you can think about it in any of the substances. But do you think you've done a good job identifying what those are?
Mm.
Okay. Okay, the votes are coming in here on this one.
Okay.
Okay, good.
It's like a horse race.
Yes. Okay. So thank you all for voting on this one here. Just always something interesting to kind of think about, you know, because really we should be identifying what they are, because our plan should be based on it. That's really why this question is here. So I'm
Now,
glad to see a lot of folks are doing that.
Nicole, do risk and protective factors in communities change? I mean, how often should you be assessing, would you say?
Well, I know some communities that do assessments annually. That is, it's labor intensive,
Right.
truly. I think a good cadence is every 2 or 3 years, you know, just for staff capacity. You know, and I don't know if there is like a explicit recommended frequency, but they can change. They definitely do change. And so it's good to have a real good pulse on what's happening in a community.
Yeah.
But sometimes that's a capacity issue to be able to do it. Yeah.
Yes.
So, okay. Okay. So a couple of the things to kind of think about here in planning. When you are developing your intervention based upon your risk and protective factors, you really want to have a comprehensive approach to the work. We, yes, are individuals, but I, as an individual, live in relationship with an inner circle of family and friends, that lives in a community, that lives in a society, right? And so we want to be thinking about our approaches in the spectrum, and not just individually focused. So Kristin mentioned earlier environmental strategies. Again, we go back to the video and the 5 types of strategies, right? It's not just individual based. We've got to be thinking about the whole, because that's where we really make the greatest amount of change in general. Okay. So you want to think about those sort of things in that context. I want to share, you know, the last picture there on cultural relevance. And it's really kind of thinking and considering the fact that when you do pull an evidence-based approach, curriculum, strategy, it's very possible that that strategy might need to be adapted in a way that meets the community's needs, that is culturally relevant. And we're going to talk about that a little bit more depth in the implementation phase, but I mention it here because you want to plan for it, right? And in order to plan for it, that means you got to actually know the community you're serving, so that you can understand if you're needing to make adaptations or do things a little bit different for a community. But we'll talk about adaptations here in a little bit. So one last thought here. Many of you have probably heard of the term SMART goals. I'm so happy to see SMART has been updated to SMARTY to include our inclusive and equitable concepts. And so when you're creating your goals and your objectives for the work you do, you want to be thinking about really them being smart and inclusive and equitable too, as just a framing of how we're thinking about this work moving forward. So I hope other people like Smarty. My nerd brain loved it. I was like, yes, plus I like the candy Smarty too. I just thought it was a very innovative way of bringing this in here. So what are our health equity questions when we're thinking about planning? And 2 we'll leave with you. The first is thinking about, have I truly invited the community to be a part of this process? because they'll tell you whether or not the intervention idea is culturally relevant. And that is a powerful thing to know. And have I truly thought about the need to, about whether or not the idea we've come up with is a good cultural fit for the community, okay? This is really thinking about the equity piece in the planning part. And considering that. So with this, we do talk about the need sometimes to adapt our work that we do. So I want to just bring up a Mentimeter here so I can just gather from you all, out of curiosity, have you or do you currently monitor your implementation activities for fidelity and cultural relevance? Just curious. Hey, this one is a little harder one.
Mhm.
For sure. Yeah, okay. Okay, very interesting. This is probably the most diverse we've seen the graphic here
Yeah.
today. But this is the harder one, because often I think people plan, they move into implementation, but there's not a true monitoring for the fidelity part. And again, like I said, I will define fidelity here in a minute, but I was curious because if you're truly going to monitor, that means you got to plan for monitoring, right? Which is why I'm asking about it here. So when you're doing your planning, just make sure you're thinking about, if you're using a evidence-based strategy, how will we monitor that people are actually doing the strategy the way it was designed to do? It's an important thing to think about in your planning phases. Okay, all right. So moving right along, you all, we got 2 more spots left here in our SPIF implementation. So this is where the rubber meets the road. This is where often your folks are ready to kind of do and be. All of the work previously culminates into, we're actually going to deliver our services and do the implementation. This is where, remember the VMOSA, the A is for action plan. Implementation is all about realizing, materializing the actual action plan. And this is so important. It can be so critical for making sure you actually accomplish what you hope to accomplish, okay? During the implementation phases, we should ideally be following our action plan, okay? And this is what helps us make sure that we've applied science to action, okay? That we've actually thought about the fidelity of a program. And when I say fidelity, what that means is actually following the recipe, if we call it that, the way it's written, okay? Because in order for something to be evidence-based, it means that there's been research placed into it to truly understand what are the components that actually create the change that we want to see. And then it's been tested and replicated and duplicated many times to get consistent results. And so with fidelity, what this means is you're retaining the core features of a program so that you know that when you do your evaluations, you should be anticipating certain outcomes based upon you having done that. We mentioned this in planning, but we mentioned it too here in implementation. You really want to establish supports, monitoring. How do we know that people are doing what they said they were going to do, especially if it's a curriculum? Let's say the curriculum has 12 sessions and the person decides to only do 8 of them, that's going to impact your outcomes. And you need to know that that happened, right? And without monitoring, how would you know that that happened? That's where all of this really, really comes into play here of how these things work together. So when we're doing this work, you all, there is always this kind of balancing act that happens of fidelity, because I know that research says this is good to do, and then adaptation, because I realize there is a cultural relevance that I need to bring to the forefront of this work to make sure things are happening right. So what do we mean by an adaptation? I think it's an important thing to consider. Because in order for something to be evidence-based, it's got to maintain the core features. And I'm going to talk a little bit about what it means to adapt here. And I want to show this graphic on what we mean by adapting, because it's really critical to understand that when you are adapting, you're not changing the strategy in a way that makes it no longer evidence-based. Because once you do that, then you're kind of off course here. So these are the 5 components of what it means. You retain what's core, and if you're unsure, contact the developer. That's what I always tell people. If you're unsure, contact the developer. You want to make sure you've got the right capacity. So are folks trained on the content to know what they're talking about? One of the key things, you all, when you're adapting, you add, not subtract, okay? So if there are 12 core lessons, you've got to do 12. And adaptation is not doing 8. At that point, you've created something different, okay? So really think about this. You're wanting to add. You really want to adapt with care. I have seen minor adaptations, like things like updating the names of people, the context, right? I know for me, a lot of the adaptations I would do early on is a lot of the curriculums, you all, were built some time ago. They're kind of dated. And we hadn't had as many developers who were kind of bringing the curriculums into the 21st century. And so for me, my adaptations were things like even just, turning something that didn't have a visual with it, like a PowerPoint, into creating PowerPoints for it, updating the names. Maybe it said, someone listened to a CD. Well, I don't know that people are listening to CDs in that way anymore. I might say they listened to a YouTube video, right? Some of those type of things of really kind of making some adaptations culturally, but definitely adding on and not taking away from any of the core features. The main thing, if you're feeling like you need to make an adaptation but unsure how to, contact your developer. And then I say reach out to, get some TA, get some help and support from centers like the PTTC, centers like SPTAC. We're here to really kind of help you and come alongside you on these sorts of things, because creating adaptations for a prevention curriculum can be really beneficial to the community you're serving. Okay, so we want to kind of think about that. I think one of the best analogies I like to use here with fidelity versus adaptation has to do around baking. I think many people understand the ingredients inside of a cookie, pretty basic. You've got your flour, your sugar, probably some water, butter, sort of thing. But there are a lot of the same basic ingredients in a cake too. Yet a cookie is very, very different from a cake. Okay. If I keep fidelity to my cookie recipe, I keep getting cookies. But if I make too strong of an adaptation and end up with a cake, I'm far off. Okay. Now my adaptation, I could throw in some chocolate chips. I could use gluten-free flour instead of regular flour, right? I could use grass-fed butter. You know what I mean? Just, you get what I'm saying, right? I still have a cookie. But if I come out of the kitchen with a cake, I've gone rogue with my adaptations. I no longer am in the right place. And that's what you want to be thinking about when you're really looking at this work here. Okay.
Nicole, you are making me hungry, as I said in the chat, with your analogies, but I appreciate them.
It is
I'm
like
even
lunchtime.
yes, it is. It's noon here in on the Eastern time zone. I'm also thinking about policies, like how can I apply these concepts? There are evidence-based policies, and they're evidence-based because they have certain components that support getting the efficacy or getting the outcomes that you want. And one of them is to often supporting strong compliance or strong enforcement. And sometimes that's a hard one, and communities may pass a policy, but they get pushback from a compliance agency. Or perhaps there's some issues in the community where there's mistrust with the police. And so if the compliance entity is the police, the community is not going to support it. So maybe the coalition says, well, we'll really lighten compliance or enforcement. We'll just make it voluntary, or we'll use signage. Well, then it's no longer evidence-based, so you might not get the outcomes. But you can use cultural adaptations and say, well, maybe it won't be the police department. Maybe we'll hire another agency to oversee compliance. Maybe it's code enforcement, or maybe we find some other group to support it that is not connected to the police. So these issues also do come up when you're thinking about policy. And I'm thinking municipal policy. There are also organizational policies that maybe a company decides or a business decides to have a policy. Same thing.
Yeah, definitely. Thank you for that. So back to Minty, we got a question for you all. Curious about, it says, we adapt interventions to meet the needs of our communities. I am curious the degree to which you all would agree with this statement. Okay. Oh, I'll put up the code here too, just in case anybody got blocked out of Mentimeter. Here we go. I'll show the access code there too. Oh, and somebody learned annotating.
Well, and I think, again, this goes back to having relationships and partnerships with community and engaging community voice. Your agency may not understand what adaptations or even should be considered if you're not engaging community in the assessment and the capacity and the planning stages of all of this.
Mm-hmm. Yes, yes, yes.
So it looks like generally, yes.
Yeah. This is great. That's wonderful. I'm so happy to hear this. Adaptations can be a really important strategy. So this is great. Awesome. Okay, so I had a video here. Give me just a moment because I did have to edit it to shorten it just a bit. So let me bring it up here in another window. Give me just a moment. I thought I already had it open in the background, but I did not.
While she's doing that, if anyone does have any questions about anything that we've spoken about so far, feel free to put them in the chat, because we will go back and address them at the end, because we will have time for Q&A. We'll make sure to get that code, Jean. Next time we bring up a mentee, she'll make sure to get that code up there.
Okay, yeah, someone got locked out of the mentee.
Looks like it.
Okay. In 1 second here. Here it is. Okay. And I don't know how to, sorry, I don't know how to, the annotation, I don't know how to clear that. I see it on my side. I don't know if you can see it on your side.
I can see it. The annotators may need to select the erase and go and erase.
Okay. Okay. So let me just show this quick video here. This comes from CDC. And I edited it because it's a longer video. We didn't need to see the whole part of it. But they talk about actually adapting visual communication images. And so I thought this might just be helpful to see in thinking about the work that we do. Make sure though.
Think back to the last time you picked up a health brochure and thought, wow,
Nicole?
this is made for me. They really get it.
No.
Oh, sorry.
We can hear it loud and clear, but we can't see it.
I think I have to do a new share. It must require a new share. 1 second. Thank you for that. I was like, is that showing up? And it wasn't.
No.
Okay, here we go. Let me just rewind it just a dash. Here we go. Okay.
Did you stop the share and reshare? Because I'm still seeing what was up before.
Ah, okay. Here we go. Resume share.
There you go.
There we go. Thank you, technology.
Think back to the last time you picked up a health brochure and thought, wow, this is made for me. They really get me. Chances are the materials that made you feel that way had one or more of these qualities. The information was personally meaningful to you. It was in a language you understood. It included examples, wording, and visuals that were relevant and meaningful. It reflected your values and concerns. That's the response you want from the people who could most benefit from your efforts to promote diabetes prevention and self-management. You want each person to feel, this is for me. Welcome to CDC's video on cultural adaptation of materials, how to get it right. In this video, we show simple and inexpensive ways to make your materials more relevant. How to take 3 steps to make sure the material matches the culture. Where to find already adapted materials, and what cultural adaptation looks like. What do we mean by cultural adaptation? It's changing a material in ways that ensure people of a given cultural group find it relevant. An adapted material is tested with members of the audience and refined until it works. Culture is more than just race or ethnicity. Cultural groups share a common history, beliefs, and behaviors. Age, religion, or gender identity might also be thought of as cultural groups. In fact, most of us belong to multiple cultural groups. In health communication, our challenge is to find the cultural identity that is most relevant to a person's decision-making about health. This is why it is important to understand your audience. In developing its diabetes prevention and management materials, CDC has applied principles of behavior change and health literacy. Consumers from many cultural groups have reviewed the materials along the way to final design. Still, you may wonder, is this material a good cultural fit for my audience? No need to guess. Learn from the people in that cultural group. Here are 3 simple steps to get it right. First, watch. Who are the end users of the adapted resources? Which materials do people pick up, and which do they pass over? Which materials are people drawn to? What do those have in common? Then, listen. Ask a few individuals from the cultural group to review the material. How many is enough? As many as possible given your time and resources. Use typical questions from a pre-test to learn how they respond. Ask, what do you think of this? How likely would you be to read it? What, if anything, do you like about it? Who would you say this material is meant for? Why do you say that? What parts of this can you relate to? Some people may take offense at this material. Do you find anything inappropriate or offensive? Be sure to get input from diverse members of the cultural group, or you may wind up reinforcing a stereotype. Consider the opinions of a native speaker or a local champion of the target language, someone who is fluent and knowledgeable about the cultural norms. Be sure they are also familiar with the designated health behavior and how people in the target audience will relate to how it is portrayed. Be careful in your choices of images. For instance, before you pick photos to represent Hispanic Americans, remind yourself that people in this ethnic group may be of any race. When you include diverse images, look at the roles or positions of power portrayed. For example, who is the doctor and who is the patient? If representatives from the cultural group agree that the material is designed for them and they take no offense, there's no need to adapt. However, if these individuals tell you that the material is not resonating or it doesn't seem relatable to them, check whether CDC or someone else has already adapted that material for the group you want to reach. Then, test the already adapted material with as many and as diverse a collection of people within the group as possible. Very likely, you'll find that the material speaks to them. Still doesn't work? The answers to your questions will have tipped you off to the specific changes you may need to make. Mock up a new version and test that. Keep going until people say, wow, they really get me.
Okay, so that's the part I wanted to show from that video. And what I find so fascinating, you all, is that that video actually, I'm sure you heard at the beginning, was made by the CDC for diabetes, right? Yet truly the concepts apply to any time you're doing prevention communications. You know what I mean? Just powerful things to think about when you're needing to make adaptations, being that so much of our work does require some sort of communication component to it. You know what I mean? I thought it was just really important to kind of think about those 3 steps. So a couple things of thinking about here as we begin to close out implementation. You want to really consider what are all the supports you have in place during your implementation phases. You know, does your community have a favorable history with your organization, with prevention strategies? Sometimes if the history is not favorable, you've got to work on that image of the organization in the community. You obviously want to make sure you have leadership support for the work you're doing. You want to be thinking about who are your community partners, whether they are providers that you're needing to collaborate with. Maybe you're deciding to leverage community partners to help facilitate content, and they need training and support to do that. You want to make sure you have a clear plan of action in place so that you can monitor whether or not the work is being done in the way that it's intended to be done. So what are our health equity questions we want to ask during the implementation phases? We really want to be thinking about fidelity, about if we had to make any adaptations, because that would show that we were really thinking about the community we're serving. We are monitoring our process for looking for success. One of the places that people really miss is truly documenting the how they did what they did. 1, it helps you replicate and do it again, but 2, it helps us share how we're successful with other community partners, with other organizations, so that they can have the same sort of experiences in their community too. And then what's also important in implementation is, have we thought about how we're communicating our work and our progress back to the community? Because if you think about it, sometimes the community only hears from us when we need data, okay, and when we want them to show up as a service participant. But it's important that we also share back to the community, here's what we've been doing, here's what it's looking like, here are our successes, here are our challenges. The community wants to hear that part too of the work. All right, so we are moving into our last section. Here we go on evaluation. This is really kind of the accumulation of everything. And I love that evaluation sits right next to assessment, because truly, you all, our assessment data becomes the baseline for our evaluation. All right. Our assessment tells us where we're starting. Our evaluation helps us look at, wow, after we've implemented our program, here's what we've seen as those overall results. Evaluation, I think, is one of the parts of SPIF where, in general, there's 2 things I see happen. Usually there's someone who's hired to do it, and as a result, we kind of don't know what's happening at all in the evaluation. And then typically what I also see is that evaluation has a tendency to be thought of haphazardly or at the end or last, you know, and then people are often saying, man, I wish we had thought of this. So that's why I said earlier, you really want to be thinking about your evaluation very, very early. With your evaluation, you want to make sure that it's in alignment with your mission, okay? And your evaluation will help you improve what you're doing so that while you're monitoring, let's say you notice you're 6 months into a program and you're not seeing the outcomes you want to see. If you're truly monitoring, that data allows you to create a shift not to have to wait to the end to find out, oh man, this didn't work, but potentially to see what's not working much earlier so you can create some changes. Of course, you have the coordination of resources, you have accountability. Are we actually doing what we said we were going to do from our action plan? But evaluation can be used for celebration. This is how you say, wow, here are our wins. Here's what we did well. And that leads into your sustainability. Funders like to see evaluation. So the cool thing about your celebrations, this also becomes the seed for saying, hey, we're successful. Give us more money. We can do more. We can reach more people. And that can be a really critical thing of the evaluation component. How is evaluation helpful? It allows us to conduct a process evaluation. If this is a term that you are not familiar with, process is really helping you articulate the how you did what you did. It helps us understand our outcomes. What is the result of our work? As I mentioned before, it helps us make mid-course corrections if needed to. And importantly, we use our evaluation results to share back to the community. And of course, many of you do this by sharing back to funders and doing reporting. In general, we want to also be thinking about how we include the community in the evaluation process. I think this is another space where the community gets forgotten about. But truly, there are folks in the community who would love to be a part of helping you evaluate whether or not a program and be a part of understanding cultural adaptations that need to have happened throughout the intervention phase or implementation phase of the work. So just a few more things here that I want to share in evaluation. I am tracking our time here. We've got about 7 minutes left together. So I want to make sure we do finish what we've got ahead here. I've mentioned these two terms. Process evaluation is not the same as outcome. Again, process is saying, did we do what we said we were going to do? And outcomes is, what was the result, the impact on the people as a result of our work? And you really want to make sure that you look at both types of evaluation. A couple principles to think about when you're evaluating is the utility. This is about making sure that your evaluation meets the needs of your funders, okay? A lot of times when we receive grants, there are specific metrics they're expecting to see. So your evaluation lets you kind of make sure that there's good utility for what are you collecting data on? Is what you wanted to do truly feasible? Remember, because in the planning phase, we're kind of just speculating on what we think will work. Your evaluation really lets you say, wow, this was feasible, or we were not even realistic on what we wanted to do. Now, propriety, this is about making sure the evaluation is conducted in a way that is legal and ethical, that your program is being respectful, delivered in an equitable way, and that we're really maintaining that do no harm aspect of our own competencies as a profession. And then, of course, accuracy. So evaluation really helps us, again, did we hit the mark with what we were trying to accomplish? Did we clearly describe the program in practice? Did we gather and use the information in a way that was going to be helpful so that we could really, truly justify what we discovered in our implementation of a prevention strategy? So we really want to kind of think about that. See, and that's my timer, making sure we were keeping in alignment with our time here today. We got 5 minutes left together. So just two last things here. Love to get from the group. Oh, and let me show the code here again. Sorry about this. Here we go. Access code and QR code are being shown. We engage our focused population in developing an evaluation plan. I'm curious how many of the folks in the room feel that they're doing this part here. Okay. This one is a little bit harder, but I'm loving that we got some yeses in the room. This is great. That is really great. It's so rare to see that we actually include our focus populations in the evaluation component. So I definitely encourage folks to continue to do that if you haven't. Awesome. Okay, so I leave you with the two health equity questions we want to be asking. Is really related to the previous mentee. You know, are we involving our community members in understanding in how we collect our data, how we interpret, how we actually disseminate the information? And are we using some mixed methods? Are we, having some qualitative data in there, which means asking people questions and getting information that's in a narrative form? It's a really critical thing to kind of think about. All right. So as we come to our close today, I'm going to bring up a word cloud here and give you all an opportunity to share, to use up to 3 adjectives. You'll see 3 options there of what is circling in your mind. We've spent 90 minutes together. I know for me, it went really fast. And so I'm curious, what are some of the adjectives of what's circling in your mind right now as we come to our close here today with our time together? And as you all do that, it will show up here on the slide as a word cloud. If you know how word clouds work, the more people who use the same words, those words end up getting larger here in the space. So we'll give you all a few minutes here to share your thoughts. Wonderful. Look at that. Got some really good thoughts coming in here. Thank you all for your input.
I love equities on there.
Yeah. Great.
Good adjectives.
Yeah. Thank you all. Thank you all. And like I said, what we will do after the session, we'll download this presentation. It'll have all the mentees in it. We'll give it back to you all so you all can look into it more detail and really look at the resources and the words that are in the document here. Inspired. Look at that. Wonderful. So in the chat, I want to draw you all's attention to a few things in the chat while our word cloud is still developing here. With just our last couple minutes, there are 2 links here. I ask that you please click on both links. The first link is from Kristin. This is our GIPRA, our evaluation from SAMHSA. It's a part of what lets SAMHSA know that this service happened today. And then, of course, for those of you who are needing CEUs for your time today, please click on the second link from Jasmine. That gives you the SurveyMonkey link so you'll have what you're needing to actually get your CEUs for the session today. So I really want to thank you all. This has been a wonderful session together. I hope you all have found this time valuable. And we'll be passing some of the resources back to you all. And I want to thank you all for being here today.
Absolutely. Thank you, everybody. I didn't see any questions in the chat. I saw thorough and thought-provoking. So I think people are filled up and they're pondering. So do make sure you do that SurveyMonkey that Jasmine put in the chat if you want to get your CEs.
Awesome.
Well, Nicole, it's always great working with you. Thank you so much for collaborating today.
This was awesome.
Sharing your incredible knowledge.
Awesome, awesome. Well, everyone have a wonderful day.